Minimum unit pricing for alcohol should be increased from 50 pence to 65 pence. After it was introduced, Scotland saw the amount we drink drop to its lowest level in 26 years. Deaths and hospital admissions from liver disease also reduced. But the impact of 50 pence per unit has been significantly eroded by inflation since it was approved 9 years ago. And modelling suggests a higher price would save and improve many more lives. To optimise this life-saving policy, we need to increase the minimum unit price to 65 pence.
And Alison is here to debate her arguments with the club owner and columnist, Donald MacLeod. Thank you both for joining us. So, Alison, why do you want it to go up from 50 pence to 65 pence? Why that figure in particular?
The minimum unit price was a really innovative policy when the Parliament adopted it in 2012. Unfortunately, it was delayed in its implementation until 2018 because of legal action by the Scotch Whisky Association. And so even before it was implemented, the impact of 50 pence per unit had already started to be eroded by inflation. But the innovative policy was implemented and we've started to see some really positive benefits from it. We've seen a reduction in alcohol consumption and we saw some preliminary evidence of reduction in deaths. But in order to optimise the policy, we really need to make sure that at the very least we're making good inflation. Okay. But now that we know that it has positive effects and we haven't seen any major unintended consequences, this is the time we believe to increase the price to 65 pence.
Okay, Donald, to save lives, is this the way forward?
I think it's one of many measures that can be taken. I was a great supporter, and as Alison knows, a great vocal supporter of minimum unit pricing when it first came out. But I feel it's a bit of a glass half empty at the moment, as I pointed out in my column in the Herald. There's been no discernible, data coming in from Manchester Metropolitan Uni found that there was no discernible impact in drink-related crime, and indeed that was backed by findings by a criminologist, John Bannister, who, despite an 8% drop in trade sales on the off-trade, he found there was no discernible impact in alcohol-related crime as well. And we've got to look at what's happening in the street at the moment. I mean, there is a massive rise in spikes in alcohol-fueled violence or indeed antisocial behaviour. Now, whether it's a hangover from the pandemic, who knows? But, I think we've got to be looking at that and come up with other solutions.
So, Donald, you're saying you're against it specifically going up to 65 pence then? You think there's other ways to tackle the problem?
I think other ways should be looked at, and I think Alison knows about the Social Market Foundation's idea of, putting up the excise duty, say, in supermarkets across the board and reducing them for hospitality, where the Scottish Government themselves said was a safer places to drink alcohol because it's a controlled environment. You're not getting that when you buy alcohol in the shops. Alison,
would that not be a better idea rather than raising the price to 65 pence?
So I think what Donald's suggesting is also a price mechanism using alcohol duty. The evidence suggests that a combination of both minimum unit price and alcohol duty related to the amount of alcohol in the products is the best way to try and increase the price and reduce consumption. But absolutely, I agree with him, it's not the only way. We need to be tackling how widely available alcohol is and how heavily it's marketed. But we already have minimum unit price in place. We've already seen some benefits from it. Let's remember that this principal purpose of this is to save lives, and we're really hopeful that this policy, we saw a 10% reduction in the first year of implementation. That's been wiped out by the COVID effect, unfortunately, but we have a whole load of people who are extra vulnerable to alcohol harm because of the pandemic and because due to stress and anxiety they've increased their drinking. So we need this policy more than ever.
I mean, Donald, you know, do you not agree with Alison that we've never needed more help at the moment, because after COVID, you know, so many people did turn to drink? I mean, do you accept that Scotland does have an alcohol problem?
I don't accept it's got the problem that we used to have, not at all. I think we've managed to bring it down with all manners of measures, and a lot of it is the way that hospitality has reacted to it and brought in stricter measures at the doors and the way we sell alcohol. There should, you know, if this minimum price is deemed to work, then let's see the evidence. At the moment, we have still not seen the evidence, and as I say, it's done nothing to bring down crime, and you know, we really should be focusing resources on that, because that is a huge problem at the moment.
Alison, what evidence is there that it has worked?
Well, the principal source of evidence is around the impact on consumption. So it's reduced consumption by 3.5%. So that's pretty significant. We also saw a reduction in deaths of 10% in the first year, and we've seen reductions in hospitalisations due to liver disease in each of the first 2 years. So there is some preliminary evidence. It's not as strong as we would be hoping, and we attribute that in part to the fact that the level isn't right yet, and that's why we're calling for it to be increased.
Donald, what do you make of that evidence?
Yeah, look, I am not against it, as I've said, not wholly. I would just like to see more data, more evidence. And, you know, the National Institute of Health Research recent study there found no evidence of harmful or beneficial impacts of minimum unit pricing. So I think we need more data. We need more evidence. But, you know, as Alison's pointed out, it was the first step of many in bringing down, you know, the effects that, you know, harmful effects of alcohol that it has on some Scots. And so we're on a journey, but it's a long journey. We shouldn't be rushing it in, you know, just hiking things up just willy-nilly before we get the evidence.
I mean, Alison, very briefly, do you think there's any chance this might come in? I mean, there was quite a reaction to the 50 pence, wasn't there?
Well, actually, public support for minimum unit price has grown since the policy was implemented. So, you know, the public are supportive. The Parliament were obviously supportive the first time around. We believe that the evidence is there, that the policy can and is delivering benefits, but that we need to really ensure that we're saving more lives and improving more lives through optimising the policy.
And we'll have to leave it there, but thank you both for joining us this evening.